I'm Heather, and this is my mom, Christy, and we're doing a nutritional counseling session today. We're doing this because as a dental professional, it is our responsibility to inform our patients about what foods are good and what foods are bad for you in relationship to the oral cavity. Hopefully by doing this, I'll be able to make some recommendations that you'll find helpful to help improve your overall oral health. Let's see. Had you fill out a health history here. Some of the things that we'll want to take in consideration while do your counseling today is that you have high blood pressure, you have diabetes, and that you're also taking a calcium supplement. Let's see. And we did an extraoral and intraoral exam earlier, and the findings were just that you have xerostomia. Do you know what xerostomia is?
No.
Okay. Xerostomia is dry mouth. Do you notice that you have dry mouth? Does it bother you? Okay.
Especially at night.
Okay. One of the reasons that you could be having dry mouth is because that you're taking a lot of prescriptions, and a lot of medications will dry out your mouth. Unfortunately, a side effect for this is that it can increase your decay because you don't have as much saliva in your mouth to rinse out the food debris. So you'll especially want to make sure that you rinse or that you drink a glass of water after your meals or snacks. Let's see. I have a flip chart here. Has just a list of some karyogenic foods, which are sugary foods that can contribute to decay, and as well as karyostatic foods, which are foods that will not contribute to the caries process. Just some examples of karyogenic foods are fruit, candy, bread, milk, soda. Some karyostatic foods would be like proteins, most vegetables, and hard cheeses. But it's important to note that even though the fruits and milk are karyogenic, that they're still an important part of your everyday diet. Let's see, and I had you go through and for your 3-day plan here, circle which foods that you thought were karyogenic, and then I went through and highlighted the ones that are. And for the most part, you got a lot of them right. The parts that you missed it the most were like the dairy products, like the milk, and then the chicken breast that you had isn't karyogenic, but since it had the Parmesan crust on it, that would make it. And you didn't highlight or circle the broccoli salad, which the broccoli wouldn't be karyogenic, but since it had the raisins in it, then that would just again on the next day with the milk. And also you didn't do any of the crackers. Crackers contain carbohydrates, which are sugar, and also the bread, even though it was wheat bread, it still contains sugar. Let's see. Okay. Let's see, and how the caries process works here. I have a chart for that too. You need 3 things in order for decay to occur. The first is bacteria, which in your oral cavity you just normally have bacteria. The second is the sugary foods, so your karyogenic foods, and then a tooth surface. So what happens is when you eat those sugary foods, the bacteria in your mouth feeds off that and produces an acid. The acid if it's left sitting on the tooth surface long enough, then we'll create that decay. And then I have a picture here kind of what decay looks like. It's an extreme case, but I can just show. I don't know if you can see that. Okay. Let's see. So it's just important that you don't eat as much sugary foods if at all possible. You know, try to do more like of the vegetables, and sometimes, like I said, it is necessary, like the milk and the fruit and all that. So rinse your mouth with either just a regular rinse or water, or drink water after that, and that will help disrupt the bacteria in your mouth to prevent that. Okay. Okay, and then we were talking about the carbohydrates too, which were one thing that you were kind of confused about on here. Let's see, so I have another page that, do you know the difference between like simple and complex carbs, or have you ever heard?
I've heard of it.
Okay. Okay. So obviously carbohydrates are needed to provide energy, but there's some better choices that you can make. You know, like you had the crackers and stuff on there. Those would be like a simple carbohydrate. They contain very little nutritional value and are digested quickly by the body. So if you notice, when you eat those, you don't feel as full. Those would be like cupcakes and jelly and white bread. It doesn't stay with you as long. And then there's complex carbs, though, that contain fiber and vitamins and minerals. They take longer to digest, so they stay with you longer and you feel fuller. And those are like your whole grains and your fruits and your vegetables. And the more natural of a state that the complex carbs are in, the more complex they are, so the better they are. So if, you'd want to choose like a fresh fruit or fresh vegetable over a canned fruit or canned vegetable. You really want to try to incorporate more of the complex carbs into your diet and less of the simple carbs. And especially since you're diabetic and you're watching the carbs that you eat anyway, you want to make sure that they are the complex. It'll make you feel fuller longer and then eat less. Okay, let's see, we have printed out your report here for the we have 3 different ones, and there wasn't very many nutrients that you were over on, but there was some that you were under. Let's see. For all 3 of the days, your fiber intake was under. And even though fiber isn't digested by your body, it's still important because it'll help you maintain a healthier weight, and it can lower your risk of diabetes and heart disease. Some foods that you can get fiber from would be like fruits, vegetables, and whole grains. Let's see if we look at the next page on here for the minerals. Let's see, for all of the days, your calcium intake was under, and I have in my chart some information about calcium here. Calcium is important for your teeth and your jaws because they're mostly made of calcium, and without enough calcium you risk developing gum disease and tooth decay. And you can get foods from you can get calcium from foods like milk, yogurt, cheese. And I noticed that you're taking the calcium supplement too. Is there anything with calcium that you don't like, or And do you drink milk a lot, or?
I just don't like milk that well.
Okay. So the calcium supplement will help with that. And also they have like almond milk or something that you could try that contains calcium just like regular milk. Another one that you're under on is your potassium. And you can get potassium from vegetables, like leafy green vegetables. Another one is your iron that you're under for all the days. And iron, a deficiency of iron can cause your tongue to become inflamed. And iron is found in like red meats, and you can get it from like bran cereals. They also have iron supplements that you can take as well. Let's see, another one that you're low on is your vitamin D. Vitamin D is important because it helps your body to absorb that calcium. A diet lacking in calcium can cause burning mouth syndrome, and again, you get the vitamin D from the milk, all of that. Vitamin D is also known as the sunshine vitamin, so you can get vitamin D just from being out in the sun. It's recommended that you 2 to 3 times a week just spend 5 to 10 minutes out in the sun. It doesn't have to be direct sun, but then you can absorb some of that because it'll help, make strong bones and teeth. And then the last one on here is vitamin E, which you can get too from the leafy greens and whole grains. So I got this information about your diet from the new, have you heard of the Choose My Plate? And it's the new kind of food pyramid that they've come up with. Just some tips that they have on this is that you want to make half of your plate fruits and vegetables. Make at least half of your grains whole grains, so the more complex grains. Switch to fat-free or low-fat for your dairy products instead of like whole milk, 1% milk or skim milk. The proteins that you eat, you want to have lean proteins. And to lower your risk for heart disease, you can cut back on foods that contain saturated, trans fat, and cholesterol. And so kind of look here and show you. So for the 3 days here, for the food groups, you have you met the target for the grains on all the days, except for you're not eating the whole grains, you're eating the refined grains, and you want to make half of your grains whole grains. So you can see, like for the whole grains on this day, you only ate 1.5 ounces of whole grains, and the refined grains, which are like your simple grains, you had 6 ounces of those. So you met as a food group of grains, you met the requirements, but you just want to make sure that you're balancing out those. And every day too, you had your protein was met, so that's good. Most of the other groups, though, the vegetables, fruit, the dairy, that was all under. So just looking back on some of the nutrients that you were deficient in and the suggestions that they had, for vegetables, a lot of them said to have leafy greens, and that'll bring up those minerals and nutrients. So like salads and like broccoli, a dark green, and then the fruits, you had under on those. So you know, because you're diabetic, so you try to avoid eating sugary foods, which fruit contains some sugar, but if you get the fresh fruit opposed to the canned fruit, you'll have less sugar then. Let's see, in the dairy, we kind of talked about the calcium of that. Yeah. Okay, let's see, and you don't have any allergies to any foods or anything. Okay. Let's see, and I just printed off these little charts here too, so it can kind of show you. See, most days you're getting the grains, but it's showing that most of them are refined. Getting a good amount of vegetables, but you could incorporate some more vegetables. The fruit, like I said, is really low. And let's see, it kind of varies by day on your dairy. And then the protein is good. So you can just use those to kind of make a food plan for the week. Let's see. Okay. So, is there anything that you learned from this activity that you did not know before?
Well, it was interesting to know which foods cause the decay. And I know that I eat more protein than I do fruit. So just because of my diabetes, I don't eat a lot of fruit.
Okay. Let's see. Something positive about this experience, I think, is that I was able to use my knowledge that I have learned from class about dietary needs and how they affect your body and your health, and able to make recommendations to somebody and teach them about it so they can also improve their health and maybe even teach something to somebody else. Next time, what I would probably do differently, I know for this assignment we only had to do it for 3 days, 2 days during the week and 1 weekend, but I think it would give a better overall picture if you did it maybe for the whole week or something. And what I learned from this experience is obviously different diseases and stuff like diabetes, you have to be careful what you're eating and how that can obviously have a big effect on the food that you're eating, because I don't have that, so I know my fruits and stuff are a lot higher, and just teaching how to incorporate those foods into somebody's diet.